Hey guys, I just wanted to give you a little bit of information so you understand what and why things aren't going to go super fast with this new move. Um, First of all, I had two bulging discs and one herniated, and the herniated disc impeded on a nerve or a system of nerves that prevented me from walking without excruciating pain. And it took almost 8 months just to get to the point where had all the tests done and had to do MRIs, CAT scans, a nerve conduction test, and then of course all the pre-op tests for surgery. And then the surgery was finally done to repair my back. The herniated disc is repaired. The bulging discs are repaired. Now, what ended up happening is, one, I was told I have super strong bones by my surgeon. For someone who's almost 56, I'm like, yay, I did something right. And then on top of that, I'm sorry, I'm a mess. First day here after moving, and I've been working all morning. Back to the surgery. The first surgery seemed to go great. I was pain-free fairly quickly. Within 2 days, I was off pain meds, which to me was huge. And they sent me home, and I started recovering. But then I was home, I think, less than 2 weeks. And my incision started leaking fluid. And it was leaking enough fluid to be very concerning, because it had no leakage after the surgery. So what we ended up doing was going back to the hospital, checked me in through the emergency system, and I started getting headaches, nausea. Some of that hospital stay I don't even remember. I had family come to visit me, and I don't remember, and that's heartbreaking. But I was very, very sick. This is very hard. What they found was when my surgeon worked on my herniated disc, he nicked my spinal membrane, if you will, that encases your spinal cord, which has all your spinal fluid in it. It's called a CFL leak is what I had. And when he went in to see what was going on, the second surgery, he found a 1-inch tear in that membrane. So he repaired that, and I was actually in CCU, critical care unit, for at least a week to almost 2 weeks because of how sick I was. And to be honest, I got better care when they moved me out of that floor and put me into the surgical floor. So I can't even tell you. I could tell you horror stories about my care there. And at some point I might even go into that. But I got to the point where I was strong enough and the headaches were under control. My blood pressure was off the charts through this second surgery. Off the charts. They had a heck of a time getting it under control. They sent me home with medication for it. And they sent me home with a ton of new meds. And I'm not a medication person. And you can see all this, all the fat here. I'm fat all over because they did 3 rounds of steroids prior to the surgeries. So the steroids went right to fat on me. Now I'm home from the second surgery, starting to recover, feeling pretty good. But then I started developing severe pain in my left upper buttocks, lower back area. Severe pain. Went to the doctor, back to my surgeon, and he said there's absolutely no reason to have pain. He said everything's fixed. I've been in there twice. There's no reason to be in pain. So he says, okay, we'll see you in 3 months. I'm in pain. See you in 3 months. Okay. So we went home, and at that point I was feeling pretty down, hopeless, not knowing if I'd ever be able to have normal activities again. And within a couple weeks, I developed a blister on my incision. The blister, let's go back. Yes, I developed a blister. As soon as we found it, we went to our local ER. They refused to treat me because it was developed from my surgery area. They sent me home. Yes, they did. So I went home, and within a day, I think within 48 hours, the blister popped while I was sleeping. Gooey, nasty, pussy blood came out of that. Now, we have already dealt with my mother-in-law, with her. She had MRSA. And we saw her, we took care of her. We did wound care on her. She had an open wound, and my husband recognized what was coming out of my back. I obviously couldn't see what was going on because it's in my lower back. He put a bandage on it. He actually pressed on it and got more stuff out of it. He's freaking out at this point. Put a bandage on it and decided we're driving over to the Florida hospital. And that's the name of the hospital we went to for all my procedures at this point. We drove in there, went in, they checked me right in. They started blood cultures immediately, and they immediately started me on major, IV antibiotic push. Within a few days of being in the hospital, they're pushing and pushing antibiotics. Okay? Finally, my surgeon comes in and says, yep, we got to go back in. Lucky me. So he schedules the surgery. We go in. He cleans out my back. So I call it my rotor-rootering that he did. He went in and cleaned everything out. The whole surgical area was involved. I actually also had a large pocket of pus that he had to clean out as well. So come to find out, it was a type of MRSA, not the worst one, thank you, Jesus, but it was a type of MRSA. I had gone septic on them, which just freaks me out because I have always considered myself super strong and normally pretty darn healthy and active. So they get in there, they clean it all out. They put a drain in this time. So because when you work with all that tissue and stuff, it's going to weep and drain and try and heal. And so I had a drain in me for a few days. Then the drain came out. And on top of that all, I developed a horrible case of acid reflux. They postponed my going home because I was throwing up. My acid reflux was so bad. And it took them 24 hours to get what I needed approved and in my system before we got it under control. So, the month I was in December 19th for the first surgery, January 5th for the second surgery, and then the beginning of February for the final surgery. So it's February, March, April, we're into May, and I'm still recovering. I have limited movement. I can walk pretty good right now. So walking isn't as big of a problem. I think I do better walking than anything else. My back gets very, very tight and painful. And I know some of it's got to be coming from being down for so long. And the rest of it is just when you have surgery, everything around that cut has to heal and recover. That includes muscle. So that's where I'm at. Right now, it looks like I've been out of surgery and the hospital long enough that I won't need to go back again. Thank you, Jesus. And the other thing is I had to be sent home with a PICC line. So at this point, I've had a midline and 2 PICC lines for antibiotics. So I had antibiotics after the second surgery that I had to come home with. Then after the third surgery, I had antibiotics again. 6 weeks after surgery, I was on an IV at home with antibiotics. My husband, I can't tell you enough. He took wonderful care of me. He helped me bathe. He cooked my meals. He took care of my IVs. He changed the bag. He did everything I needed him to do. As we're getting older, we're finding that even though I was healthy up to this point, that things can change. Oops, sorry for the wiggle. I got a cat now on my lap. Things can and will change. And from now on, I'm not allowed to lift. No more lifting. So 10 pounds is my limit. Whether or not that gets better over time, I don't know. I have trouble opening. Look at this. Antonio. My buddy. My buddy. This is the guy, he sleeps on my pillow. Don't do that. Don't do that. Don't do that. He'll love on the phone just to get my attention. But I can tell you it's wonderful to be out of that type of pain and to be in the recovery mode. And it's even better now that we've gotten our move to our 15 acres. And I can just go out and sit in a rocking chair because I have my little green, not little, they're big green, heavy duty plastic rocking chairs that I have outside that I can go out and sit on. And I can just enjoy. No neighbors, nothing. Oh, it's just heaven up here. So definitely working on recovery. And one of my goals is to get my garden going. I don't have a garden here. So my granddaughter will soon be out of school. And we're looking forward to her coming. She's going to come up for a couple weeks. And then she's bigger than me now, guys. You've seen her in those videos. She's taller than me now. She's grown majorly. And she's back with her mama. So things are going really good in that situation. So she'll come up and hopefully spend some time with me up here. And she'll help with the gardening. She'll help plant trees. She does it all. When she's here, she has KP duties, which is kitchen cleanup duties. So she's a great help to me. And I guess that's pretty much the update on the surgeries. I still need pain meds. Tylenol does not touch my back. Not at all. Not even close. So most nights I have a pain pill if I need it. If I don't need it, I don't take it. And one of my hurdles has been just getting a pharmacy to fill my pain meds. Go figure. A surgeon says, you're going to be in pain, you need pain meds. And then my pharmacist says, we can't fill these. Bull crap, guys. Bull crap. My husband went in there and he said, since when are you trained better than her surgeon? And since when do you get to say whether or not she needs pain meds? And they filled my prescription. But they've also refused to fill my prescriptions from my pain management doctor. So I have to get them from my surgeon or my regular physician now. I'm hoping I don't need any more because I'm reducing and reducing and reducing. I do have periods of time where I don't need them at all. But being up here, I know I'm going to overdo things. I always do. And it's a little overwhelming, everything that needs to be done. but I'm going to muck through it, do a little bit every day until my little cabin here is comfortable. We moved a load yesterday. All the animals came yesterday, and I came with them. So now I stay here to take care of the animals. Most of them are mine anyway. Our bedroom is pretty much set up the way it's going to be. We spent the afternoon yesterday setting that up. Now I'm working on getting the kitchen more functional. And he has a load of, I can't believe how many loads we brought up here. It's just mind-boggling. We should have downsized more. We're realizing that now. Hindsight, you know how that goes. But we got to get this last load here. And then he's going to focus on wiring the cabin, setting up the solar. And while he does that stuff, I'm going to focus on trying to get things to the point where every day gets easier to function up here. And I also am looking for goats. The sooner we get goats, the sooner our brush is being taken care of by them rather than us. And there's a lot of brush. 15 acres worth of brush. I hope we get some hungry goats. That's all I can say. All right, guys. God bless. Don't forget, if you like the video, like, share, subscribe. Click that little bell if you want to get notifications. Take care, and hope you have a blessed day.